Welcome to part 2 of a conversation with Roland Williams, addiction specialist. We're talking about opioid addiction in the African American community. And Roland is an expert in this area, both in addiction and recovery practices, best practices for African Americans. So thank you very much for joining us again, Roland. And we'll jump right into the second part of this conversation.
Excellent.
So is medication-assisted treatment, or MAT as they call it, for everyone? Is it for African Americans?
I don't think anything is for everyone. I think that although the powers that be would have you believe that right now, because there's a huge campaign to promote medication-assisted treatment as the silver bullet to the addiction, the opioid epidemic that we're seeing in this country. However, I do not feel like it's for everyone. I think, well, let me rephrase that. I feel that most people could benefit from the medication that's available to treat an opioid addiction. However, I think that the way that it's being heavily promoted as a maintenance as opposed to a detox medication, I think that might not be for everyone. I don't think everybody, what that means, maintenance drug use means that they want you to be on the drug indefinitely. And I think medication-assisted treatment like buprenorphine, Suboxone, Subutex, naltrexone, I think that those drugs are great to help people get off of the drugs. But I don't think that the goal is to get off of one drug to be put on another drug for the rest of your life. And that's kind of the direction that it seems to be going. So in other words, they're saying that the solution to the drug problem is more drugs or different drugs. And right. I don't agree with that. But I do think it works. And I think if it's used responsibly, medication-assisted treatment can be a lifesaver.
And what do you think it should be used? What's a holistic approach for?
Well, I think it should be used. I mean, we should have learned years ago in addiction treatment that one size doesn't fit all, that you really have to take a look at people and assess them individually and come up with a plan that matches that person. I think that it is, again, particularly with opioids, I think that the medications, methadone, Suboxone, Subutex are all excellent drugs to help people get off of opioids. But the idea of getting them off one opioid to put them on another one and keep them on indefinitely, I think that does a disservice, actually, in my opinion.
So how accessible is MAT for African Americans?
Well, that's an interesting question because I know that we had talked before about focus groups that were done with African-American clients, and a lot of African-American clients, the only medication-assisted treatment drug that they had ever heard of was methadone. So a lot of people, when we talk about naltrexone, when we talk about buprenorphine, like Suboxone and Subutex, we talk about Vivitrol, which is an injectable form of naltrexone. Most African Americans have never even heard of those drugs because they're not getting promoted at the same degree in the African American community as they might be getting promoted in the suburbs. And so what we tend to see offered as a viable option is methadone, which is a very old opiate replacement drug that's highly addictive, very difficult to come off of, and is in some ways a form of relief, but also incarceration. Because once you're on methadone, they know at 8 o'clock in the morning you're going to be at the methadone clinic, and they feel better about you being at the methadone clinic at 8 o'clock in the morning than breaking in my house at 8 o'clock at night. So once you put people on methadone, you know exactly where they're going to be every day. But methadone saves lives. To be fair, methadone saves lives. I had a woman tell me after a training once, she said, I hear what you said about methadone, but methadone kept me alive long enough to get clean. So, I think in the African American community, I think it would be great if people were more educated about what was available and had better access to these medications, and they would be prescribed responsibly. There's a huge incentive for physicians to prescribe these new drugs, Suboxone and Subutex particularly. Huge financial incentive. So there's some questions about conflict of interest when it comes to prescribing practices.
So with all those cautions, what would you like to share in closing with family and friends that are caring for, supporting loved ones that are suffering with opioid use disorder or other substance use disorder or addiction?
I would encourage people to think just because a doctor tells you that it's okay doesn't mean it's okay. That the doctor may have some incentive for prescribing this medication. I would encourage people to never rule out the possibility of being drug-free. There is no silver bullet, there is no shortcut. There's nothing wrong with having a craving or an urge or even some anxiety that people will learn to get through that. Don't be so quick to allow somebody to put you on a drug that they're going to want to keep you on for the rest of your life. Use it to get off of the drugs, use it for detox, use it for short-term crisis management or anxiety management. But my personal belief would be to not allow somebody to convince you or give you permission to be on an opiate, narcotic for the rest of your life, which is what you'll probably hear if your family member is an opiate addict and goes and sees a doctor who is a proponent of medication-assisted treatment.
Excellent. Thank you so much, Roland, and thank you for joining the conversation. For more information, please go to ONTRACK's website. It's www.getontrack.org. Thank you very much again for joining. Great to see you, Roland.
Thanks, Madalynn. You too. Much love.